All right, everyone, we're going to go ahead and get started. Hello and welcome to Check Your Health. Thank you all for coming this evening. Before we get started, one quick note. Please keep your questions until the end of the program. You can type your questions in the chat box during the program, and I'll ask them out loud at the end of the presentation. Please keep your microphone muted during the presentation. So I'd like to start off by saying thank you to Hackensack Meridian Palisades Medical Center, to Myra Guadalupe and Nikki Medeiros for coordinating tonight's event, and to Dr. Fyffe for volunteering her time this evening. Our presenter this evening is Dr. Ullanda Fyffe, a family medicine doctor from Cliffside Park. I'm going to turn things over to Myra Guadalupe from Hackensack Meridian Palisades Medical Center to introduce the doctor.
Thank you, Chelsea. Good evening, everyone. Thank you all for joining us today. As Chelsea mentioned, today we have Dr. Fyffe. Dr. Fyffe is an experienced family medicine doctor of many years. She treats a wide range of conditions. Her major goals in practice to prevent illnesses and disease onset progression, and today she will be presenting on preventing illnesses focused on screening and vaccines. Thank you for being with us, Dr. Fyffe.
Thank you. Good afternoon, everyone. And thank you, Myra, and also the North Bergen Public Library for inviting me to speak on this topic again. Definitely is my pleasure to do so. So, like Myra said, I'm a family medicine doctor in Cliffside Park on Anderson Avenue. And I've been at this location practicing for about 7 years now. And right now I'm working with three other providers in this office. So at our office, while we treat acute and chronic conditions, just like Myra stated, our main focus is on primary prevention. And what that means is that our job is to make sure that we are guiding you to do whatever you need to do so that you don't get sick. And this is what my talk is about this afternoon, really. And I'll be talking, about screenings and vaccines, and what is recommended for you so that you don't become ill yourself. And it's about preventing illness. That is what we're aiming to do this afternoon. So, next slide, please. Thank you. Great. So before I get started, I just want everyone to know that these recommendations are for persons at average risk, right? So meaning you don't already have some established underlying disease, or you're not pregnant, or not on treatment for cancer or immune suppressant therapy. This is for the average risk individual, unless otherwise stated. So it is very important that you discuss all of these recommendations with your medical doctor, especially if you're not sure if you're average risk or above average risk. And you'll hear me say this throughout the presentation, that very important that you discuss those recommendations with your own medical provider, and that you discuss with them what the risks are and the benefits, and what they will be to you, and if this is something that they think is appropriate for you based on your current conditions. Okay. And so this is not a comprehensive list of recommendations, so it doesn't contain every single recommendation that may pertain to you. And that's why, again, important to see your own medical provider, at least once a year, to determine, what is recommended for you. All right. Okay. Next slide, please. All right. So I like this picture. It's that old saying, right? That old adage: an ounce of prevention is worth more than a pound of cure. And this is, something that proves itself to be true many times, that I've seen, working in my office. So that's our goal: preventing, so we don't need to put so many resources into cure. All right, next slide, please. All right. So if you're between the ages of 20 to 29, some of the screenings that are recommended to you, if you're average risk, include being screened for sexually transmitted infections. And based on your risk activities, you may be someone who need to be screened every 3 months, but at least once a year for ages 20 to 29. And you discuss with your doctor. If they think you need to be doing this more frequently than once a year, they'll make that recommendation for you. Also, having your blood pressure checked at least once per year during this time in your life, getting your cholesterol numbers checked, being screened for diabetes, and being screened for obesity, as well. as we know, elevated blood pressure, high cholesterol, obesity, these are the ingredients for chronic conditions like diabetes and heart disease and stroke as you get older. So at this age is when we start, checking in to see if you have these risk factors and guiding you and helping you towards lowering or these risk factors so that you don't progress to chronic diseases as you get older. And for everyone, it's recommended to see your dentist, at least every 6 months um, to have a dental cleaning and exam. So that's the recommendation for dental care. And at least once a year, when you go in to see your doctor, um, to have a discussion about, drug use if you participate in that, your alcohol screening to make sure that you're not exceeding the recommended amount. And many of you may have seen on the news or recent studies showing that there is no health benefit at all for alcohol consumption. But again, you'll discuss your habits and your use of that with your provider. Tobacco use as well, being and helping you to quit if you're an individual who happens to consume tobacco. So important to at least have a discussion once a year with your medical provider so they can help you to develop a plan so you can address some of these issues if you happen to be someone who has a dependency on any of these things. Also, very important is talking to your medical provider about if you're experiencing being a victim of abuse in your relationship, whether it's actual physical abuse or emotional abuse or economic abuse. Important for primary care providers or just medical providers in general to make sure that we're talking to our patients about this thing. A lot of people may not feel comfortable bringing this up themselves, so that's why it's important that when you go into your provider at least once a year, that we at least initiate, the screening or the questions or the conversation, so that we can help you however we can. And depression too, very important for us to have this discussion with you at least once a year, so that if we feel like you may need additional resources or support, so we can guide you and help you. So that you feel like you're getting the help that you need. Okay. The only cancer screening really that's recommended for this age group is for women age 21 and older. And this is when we start screening for cervical cancer, typically with the pap smear. And it's usually done once every 3 years, unless the provider detects some kind of abnormality in testing, and then the screening may be more frequent than that. But yeah, usually once every 3 years, and this is typically the only cancer screening recommended for average risk women. Okay. And in terms of vaccines, usually, and this may be true for most people, the seasonal stuff like flu is recommended, COVID, making sure your tetanus booster is up to date at least once every 10 years, and HPV for a human papillomavirus. So this vaccine, especially in this age group, or even younger, actually, is when they start administering it. But check in to make sure that if you're in this age range and you have not yet had this vaccine, very important for you to talk to your provider if this is something that's right for you. And usually the answer will be yes. This is maybe one of the only vaccines that we have that is geared towards actually preventing a type of cancer. So that would be geared towards preventing cervical cancer in women, and making sure hepatitis B, vaccine is also up to date. Very important is MMR, which is measles, mumps, rubella. If you've been paying attention to the news recently, there are a couple of areas in the country where they're seeing higher numbers or outbreaks, for instance, in Texas, of measles. So if you're not sure if you receive this vaccine, again, checking in with your medical provider to see if you need a booster, if you need further protection. Okay. Next, please. Thank you. All right. So as we move on to the next decade in life for ages 30 to 39, you'll see the screenings are largely similar to what you would do in your 20s. And a lot of these will carry over, for the rest of your life. For instance, like the dental exams every 6 months, and being screened for, tobacco use and alcohol use, drug use, for depression, checking for obesity, blood pressure, cholesterol, sexual infections. So mostly similar to what you do when you're in your 20s. And again, the cervical cancer screening as well. In terms of the vaccines, making sure your tetanus is up to date at least once every 10 years, your seasonal flu vaccine and COVID vaccine as well. And just to remind you, you want to discuss these recommendations with your medical provider to make sure that they're appropriate for you. I did want to go back and say the MMR vaccine. So talking about that in the recent outbreak, if you're pregnant, you cannot take that vaccine. And again, we're only talking about average risk people, but anyone who's pregnant cannot get the MMR vaccine. Okay, so just want to make sure that's clear. All right, next slide, please. Thank you. All right, so next age group, 40 to 49. Again, similar screenings with the sexual infection screening, blood pressure, diabetes and cholesterol, drug, alcohol, tobacco use, depression, and dental cleanings every 6 months. Now you will see more recommendations for cancer screenings once you hit this age group. So for women, starting age 40, we'll start doing the mammograms to look for breast cancer. And then for everyone starting age 45 is when we start colon cancer screening. So right now there are a couple of options for colon cancer screening, and again, only for average risk people. So if you have a family history of colon cancer, or you have symptoms or history of like polyps from a colonoscopy, this only the colonoscopy is appropriate for you. So the stool options is not appropriate for you if you have a family history or you have some kind of symptom going on, like blood in your stool, or had a colonoscopy before that showed that you had polyps. You talk to your medical provider because the stool-based studies may not be appropriate for you. So again, for average risk people, you can do a colonoscopy for colon cancer screening. And that is when you go, you see the gastroenterologist. That's the provider who performs the colonoscopy. They take your full history, do their exam, and then they'll schedule for you to have the colonoscopy another day. And this really entails a prep. So they'll either give you some pills or a solution that you'll take the day before the procedure to basically clean out the colon. And then the following day after that, then they'll do the colonoscopy. And you'll see on your screen a picture of how that's done. So you'll be asleep, and then they'll insert a scope and they'll look at the entire colon. And the benefit of the colonoscopy is that if they find something, for instance, like a polyp, they can take a piece of it, they can remove it, send it for pathology to see if it's concerning or not. So that's an option. And for people who prefer not to do that for whatever reason, maybe scheduling, can't get time off from work, there are other options. And again, this is only if you're average risk. So those are the stool-based options. So one is the Cologuard, which usually they mail a kit to your home. You put a sample of stool in it, you mail it back to them. And they're looking for cancerous and precancer DNA in the stool. If it's normal, you just repeat it once every 3 years. And the other stool-based test is called a fecal immunochemical test. Most of the time, your provider, if they have it in the office, they'll give you the kit in a small envelope. You take it home, put a sample of stool on there, you return it, or you drop it off at the lab. And it's looking for occult blood or hidden blood. So meaning that you won't necessarily see it with your eyes when you do the test yourself. If there is evidence of occult blood or hidden blood, or you have a positive result, then you'll have to do a colonoscopy. And same thing goes for the Cologuard. If it's positive, you'll have to do a colonoscopy. But if the occult blood test is negative, then you can repeat it every year. The colonoscopy, a completely normal colonoscopy, no polyps, usually you would repeat once every 10 years. But if they find some abnormalities, the gastroenterologist will let you know how frequently you need to repeat it, if it's every 3 years, 5 years, 7, or whatever is needed. Okay, so those currently are the options. They also have like flex sigmoidoscopy and other like CT colonography, other options for people for whatever reason, who can't tolerate a colonoscopy, or it's not appropriate for them to do the stool studies. But for average people, again, average risk, typically we send for colonoscopy, or we offer the choice of one of the stool studies. But you can discuss further with your gastroenterologist what's appropriate for you or what they recommend for you. Okay. And the vaccine's largely the same in this age group for average risk people. So it's like flu, COVID, and making sure your tetanus is up to date at least once every 10 years. Okay. We move on to the next slide. Thank you. Great. All right. So as you get older, now you're in the age range for 50 and beyond. Again, screening is very similar. So depending on the individual, it may be recommended for sexually transmitted infection screening. Always checking the blood pressure, risk for cholesterol, diabetes. Again, for everyone, standard to have dental exam and cleaning at least every 6 months, an eye evaluation at least once a year, and depression screening. Women postmenopausal, average risk starting age 65 is when we start screening for osteoporosis. And again, for men who've ever smoked in their lives, this is when we screen between ages 65 and 75 for aneurysms of the aorta. And usually an ultrasound is the test that's recommended for that. And then we continue on with our cancer screening. So again, colon cancer screening starting at age 45, breast cancer continuing to screen every year starting age 40, and continuing with cervical cancer screening. Average risk for ages 21 to 65 for women. So anyone with a history of cigarette smoking that is equal to up to 20 pack years. So pack years we determine based on how many packs per day you smoked, multiply that by the amount of years that you smoked. If you come out with an answer of at least 20, you're between the ages of 50 to 80, recommended for you to have a CT or CAT scan of your lungs at least once per year to screen for lung cancer. And prostate cancer screening, typically we start at age 50 for average risk men. And again, these things you will discuss with your provider to make sure they're appropriate for you. You will discuss the risks, the benefits of these recommendations. Okay. All right. So vaccines recommended for this age group, the COVID vaccine, flu again, making sure your tetanus booster is up to date, shingles starting at age 50. The pneumonia I didn't get to edit, but as of, I think, late last year, maybe around the holiday season, they lowered the age of recommendation for the pneumonia vaccine. So now the recommendation for average risk individuals is to start at age 50, okay? So starting age 50 and higher in average risk people, you should get your pneumonia vaccine. Currently, there is a vaccine available where you just need one shot and you're done. In the past, it used to be like a shot, then a booster with another shot. But now the recommendation is one shot of the pneumonia vaccine, which is, I think, the Prevnar 20 vaccine, one shot, and you're done starting at age 50. Okay. And the RSV vaccine as well, recommended for ages 60 and up. All right. Next slide, please. Okay. So special populations. Again, I talked about, these recommendations only being for average risk people. So you're not average risk, right? You're special population if you're pregnant. Definitely you would not be doing a mammogram if you're pregnant. So again, you will have a discussion with your doctors about what's appropriate for you, okay? Some people on, with autoimmune disease or immunosuppressant therapy, some vaccines may not be appropriate for you while your immune system is being suppressed. So, for instance, like a measles vaccine, because that's actually made with that's a live virus vaccine. So you wouldn't be taking that vaccine. So important for you, again, to discuss with your provider. Okay. Diabetes, again, some vaccines may be recommended for you earlier in life if you have diabetes. So for example, the pneumonia vaccine, you may be eligible for a lot earlier than age 50 if you're someone with diabetes that's, say, in your 30s or in your 40s. Okay. Similarly for heart disease, lung disease, and transplant recipients. All right. So this is not necessarily a comprehensive list, but again, make sure to speak to your doctor, your healthcare provider, about what's appropriate for you, what's recommended for you. All right. And next slide, please. Yeah. Okay. So again, for average risk people, unless otherwise stated, these recommendations are for. It's not the full list, just the ones that I wanted to highlight that I think are very important for you to be aware of. And just make sure you check in with your healthcare provider at least once a year to determine what is best for you. Okay. And next slide, please. Oh, I think we've reached the end. All right. Any questions, concerns, feedback?
And just a reminder, you can put your your question into the chat. All right, I believe there's already one question in the chat box. Is there a certain age when screenings would no longer be recommended? For example, after a certain age, would colonoscopy prep be hard on an older person?
Right. So you're absolutely right. So for average risk people, all these cancer screenings, they have an age where it's no longer recommended, as long as the screenings have been normal, right? As long as they've been normal. So for example, like cervical cancer screening, usually we stop age 65. But if you've been having abnormal screening, abnormal results, you may need to continue screening beyond that age. So it depends on your risk factors, the results of your previous screening. You would have a conversation with your provider about whether or not you need to continue beyond the age of cutoff for average risk people who've had normal screening results. And there is such a thing called, there is such a diagnosis called frailty. So we talk about older people, right? So people who are, older and, may not have, may not have a need to continue with screening, or are very weak or can't tolerate it. Of course, something to consider and discuss the risk versus the benefits. Like, what would be the benefit for the individual?
Thank you, Dr. Fyffe.
Sure.
The next question in the chat, if I have a risk of breast cancer in the family, when should I start getting a mammogram?
Right. So it depends, right? It depends on your relation to the individual that has the cancer and the age that they were diagnosed, and whether or not they had certain genetic screenings. So it's not an easy answer. We kind of need to know that additional information, and then you talk to and then also what's your age, and you can talk to your provider about when it's appropriate for you. So it depends on your relationship to the individual, what age they were diagnosed. Did they do testing, genetic testing, stuff like that. But
Okay. The final question that I currently have in the chat box is vaping as bad as smoking when it comes to risk for lung cancer, and when should I start lung cancer screenings?
Right. So in my opinion, it's just as bad, right? The vapes, they have a lot of chemicals in it, right? There are a lot of toxins that are in there that we may not know a lot about, a lot of irritants, right, that can affect the lungs. I know some patients will, vaping was the only thing that helped them to quit smoking, but ideally, if we can get everyone, to stop smoking and not to vape, that would be the perfect solution. But I wouldn't say that vaping is safe, again, with the chemicals and toxins that may be, irritating to your lungs. And usually the screening starts at age 50 for lung cancer screening.
Thank you very much. Here's one more question. Do you see many adverse reactions to vaccines in your practice? Is there any procedure to best prepare for a shot?
Okay. So I'm thinking back, going all the way back to medical school until now, I have not ever seen an adverse reaction to vaccines. No personal experience with that. Most people do fine with vaccines. Of course, you can have like, the usual effects, like you get some pain, some swelling, maybe some fever, aches, stuff like that. But in terms of like a significant adverse reaction, I don't think I've had a patient that has experienced that in my years. And a procedure to best prepare for a shot, I guess it depends on the kind of person you are. Like, for instance, if you have a fear of needles, maybe you don't want to look when they're giving you the injection. But I don't think there's any procedure that one needs to do to prepare for a shot.
Have you ever had anyone who had an allergic reaction to a shot or a vaccine?
So no, I've not had someone who experienced an allergic reaction after receiving the vaccine. Of course, I have patients who've told me, yeah, in the past I had, a particular vaccine and I had a reaction to it. But in my personal experience, I've not had a patient who experienced an allergic reaction after I had administered a vaccine to them. And I think that goes to show how safety, they are in general, these vaccines, that we don't really see a lot of adverse reactions to them.
Excellent, thank you. So that
Mhm.
was actually the last question in the chat box. So I'm going to finish off by saying a big thank you again to Hackensack Meridian Palisades Medical Center, to Myra and to Nikki for setting this all up, to our audience for coming out tonight and spending time with us, and to Dr. Fyffe for volunteering her time. This was an excellent presentation.
Thank you. Thank you so much for having me again. It was my pleasure.
Thank you, Dr. Fyffe.
Thank you.
Take care, everyone. I hope you all have an excellent evening.
Yes. Good night, everyone. Be safe. Take care. Bye-bye.